Good morning, everyone. Everyone, good morning. Welcome to this analysis community. This is the second season of these meetings. It's a new and fresh community we are offering within the framework of GAC, Global Alliance for Care. This is the continuation of the analysis community we developed within GAC last year. Also, on the right to care, what we are doing in this session is part of three different segments. First, we wanted to share with you, those of you that were not with us last year, a recap of what we saw last year in this first community. And for those of you who were with us last year, this is also a recap for you. Now, in the case of the second part, my colleague Aileen Torres will be presenting the community this year, what we are seeking to accomplish in this space of 6 different sessions. Finally, we're going to have a third part with introduction on the key topic, the right to care, with my colleague Laura Pautassi, with Aileen. All three of us are coordinating this space. Now let me share my screen with you with 5 slides explaining this recap of the analytical community last year, 2022. Here, as I've said, we have the names of the 3 coordinators of this analytical community. This is the title of last year, Challenges and Perspectives on Care as a Right. Here, we have the starting point. Most of you connected today, we are part of GAC. There are many people with us today in this community that are not yet members of GAC. This is a global initiative promoted by the Mexican government and UN Women 2 years ago. As members, any organization, in this case, the Friedrich Ebert Stiftung Foundation, can launch initiatives, an analytical community that will develop in leadership with the Alliance. We are seeking to hold meetings regularly with experts, academics, members of civil society. Within the framework of the Alliance, the states can be members of GAC, but also civil society organizations and philanthropy organizations and private sector institutions. The Friedrich Ebert Organization or Foundation is a social nonprofit foundation. It is present all over the world, particularly in Latin America. And at the Ebert Foundation, aligned with the GAC activities, we understand the social organization of care. It's doesn't yet have a equal type of structure. We want to democratize this social care activities. We want to look at the care structure in Latin America. That is what we are trying to push. In this sense, the analytical community last year, it tried to devote efforts to recognizing care as a right, identifying possibilities, challenges, and perspectives in terms of standards in the different countries. In this first exercise, We didn't just devote it to Latin America. We had a very general outlook, and we spoke about the need of the GAC becoming a global space, not only a regional space. Although we do have Latin participation in most of the GAC structure, we decided to explore recognition of care as a right globally. Now, these are the guiding questions for that first space. Many of those questions will be repeated this year. Why care as a right? We've made progress in recognizing care as a job. There are pending issues we have to continue developing, discussing to see what care as a right means. In this sense, is this a new right? Later on, we will be discussing this with a definition articulated particularly in Latin America. This is also a victory of the Latin American society, especially the feminist society. Today, we have a definition of what the right to care means. As a right, the important thing is for us to identify who are the subjects and who are the right holders and the guarantors. The first one is the state, but also as a human right. We're all right holders. Laura will be explaining this later on today. As I said, wanting to have an approximation, a general outlook on care as a right, we set out to identify international instruments that uphold the right to care. Today, there is no international instrument defining the right to care, therefore, devoted to explain it. We see there are many international regional instruments that are upholding this right. And Laura has been studying this and she will tell us about it. And finally, we wanted to look at public policies that could and can contribute to guaranteeing a right to care. In Latin America, public policies being promoted and built are the national care systems. However, they are not the only public policy that's possible to guarantee this right. As Dr. Pautassi has also shown, there are so many policies that could be based on different elements or policies. Here you have the different topics we discussed 2022 in our analytical community. This is a virtual community, and we have complex agendas coming, therefore, from this dynamic of the pandemic. We tried to offer a schedule, a calendar that wasn't so complicated so that we could have the participation of most of the people who registered their interest. Last year, we had 8 sessions. We had one session every month, a session a month. And this year, we believe that compacting our schedule would make it easier for everyone to do their own responsibilities. Let me tell you that first we had this conceptual framework on the definition of the right to care, the international regulatory framework of care work. And Valeria Esquivel last year was the expert with us in the third session, mainly on care work, recognizing the right to care. We had a fourth session. This was like a cut-off process to analyze everything we had done collectively. After the fifth session, we dived into 3 regions. We were not able to cover all 3 regions. We didn't have much time. In this short time of the sessions, we were not really able to analyze all 3 sessions, but we did look at progress in legislation in Latin America and the Caribbean. September 6th, Patricia Cosani was the expert for this meeting. She has done so much work and she has so many documents that UN Women discussing legislative progress in the region. In the European case, you see even the titles had small modifications, but always telling us that in each region, the debate is going through a different place, different circumstance with different characteristics. Europe is the cradle of the well-being or the welfare states. So there we have a different situation altogether in Europe. However, the debate on the right to care doesn't really cover the entire region as we cover it in Latin America and the Caribbean. So we were not able to truly have a general overview at the regional level as we have it for Latin America and the Caribbean. In the case of the European region, we worked on 2 cases, the Spanish one and the Swedish one. Spain is a country where we are holding debates on the recognition of the right to care. And the Swedish model is a model of paradigms. We can say it because it includes care policies for the senior citizens, especially. Now, in terms of Asia, November 1st, last year, we discussed with our expert from Oxfam Asia. She told us about the debate on the right to care in Asia. And in the case of Asia, what they're mainly working on is the concept of care work, not so much right to care. And finally, we had a conclusion session with challenges we still have on the table. And finally, here, from what I've already told you, these are the preliminary conclusions. We were able to see last year that in Latin America and the Caribbean, the care agenda is part of the public debate, is part of the political agenda. It has also been promoted mainly through the feminist movement. Therefore, care activities are within the feminist agenda. And here, especially in the Uruguayan case, which is the case of the first national care system in the Latin American region, we're talking about this fourth pillar of well-being. There are many laws, legislation. Laura will be talking about this, and comprehensive care systems are in Latin America. We have a public policy that could perhaps ensure the right to care. Let me also tell you that in the Latin American case, we have the Inter-American Model Law of last year. It is quite a recent legislation, and efforts and progress made at the national level are having the scaling process at the regional level. In the European situation, this is a topic in the political agenda. Perhaps they don't call it as care policy in most of the cases, as I was telling you, but there the main characteristic is that the point of departure are the well-being states. There are classical ones, and the characteristic of those states is it has to do with the importance of their tax-paying system, which is the source of financing for those policies. And public services are also broader and very robust. Maybe a characteristic that was perhaps only in Europe was the aging of the population. This is something that is now also happening in Latin America and Asia. And also at the European level, we have the European Care Strategy of last year. As you know, this is very much related to the European Union. Common policies in the European Union is sometimes too bureaucratic and slow. However, they already have their European care strategy, and this is also showing how much progress is being made in this agenda, in the political agenda. In the case of Asia, what we said was that what we're talking about, what we are studying, has to do with care work. The labor situation is being included in our discussions. And we concluded in this session there that care activities in Asia, from what our Oxfam colleague told us, is that there's the economic entity that is really ever present in Asia, not so much in Latin America, although we are recognizing care work and the economic value it represents. But they also have a debate on the right to care, which is not the case of Asia. Finally, although the regions are diverse with different points of departure, we clearly share the matrix of the care issue as a public issue with labor division. This means this should be characterized in a general model with a familistic and feminized model. And of course, this is cross-cutting in all three regions, and perhaps this is also an articulating axis for our work in all three regions. I am going to conclude in just 1 second. I'll stop sharing my screen. The 8 sessions of the previous analytical community, they have all been recorded. We have a report on them. Everyone participating in the community has access to the collective drive with all the information. So give us a couple of days, please, so that we can organize everything what we are going to be doing as of this second community. But if you are interested, you are going to be able to hear some of those sessions, the European, the Asian, and the Latin American activities. The idea here is for us to work together to continue doing this work. Very well, without further say, let me give the floor to Eileen Torres, my colleague. She is part of the coordinating body of this analytical community. Eileen Torres is a member of a group, also a feminist group, promoted by the Ebert Foundation regionally. And with the Ebert Foundation, we started working on this in a very systematic fashion. We started studying and analyzing the economy of care. And this is something we've been doing since the year 2018. We do have interpretation, and please speak slowly so that we can have the best interpretation possible. Thank you. Thank you so much. And what a pleasure to be sharing with all of you the second season. As Elisa has told us, on the analytical community of GAC. This is the second season because we have threads of continuity for our work. And we also have novel things in this new season. I will share that with you. Elisa has already told us so many things on what we discussed last year in the analytical community of last year. As I have said, a key item has to do with thinking not only of care as a right or care as work, but also care as a right and work. Thinking of the link in the analysis of politicization, the collective political construction, the construction of standards and institutional frameworks in this context and as an activity, a right at work? Well, this is a challenge. Many times when we analyze care in terms of work, and then we go into care as a right. And in this analytical community, as the previous one and this one, this year, we want to put right in the center of our discussion the right to care. Now, in the previous analytical community, even from the title, we see the main vision, the main objective was to think about challenges and perspectives of care as a human right. This was the slogan, the title of the analytical community we developed last year. Now we have a proposal based on those learnings and those lessons that Elisa mentioned, but with a different angle in terms of our current analytical community. This has to do with the effective exercise of the right to care in Latin America and the Caribbean. If we analyze and compare both titles, challenges, and perspectives of care as a human right and the effective exercise of the right to care in Latin America and the Caribbean, we find two fundamental differences, and this is what I wanted to share with you so that you can understand the analytical community this year. First, we want to emphasize mainly, and this is going to be the first part of our discussion. This is what we are proposing for it to be the first phase of the discussion. Concentrate on making the right to care an effective activity. How we are doing this, the way we should do it, how we aspire to doing this, and how can we make the right to care effective? How can it be an effective activity with all the necessary standards and the necessary institutional framework? At any rate, what we care about mainly in these discussions we are going to be holding this year throughout this following months of 2023 is to think about concrete practices, institutional standards, general policies, concrete practices, and we are going to analyze them, trying to relate them and include them in our conversations for us to analyze practices among territories. And we are going to analyze them looking for deficits. Which are the problems we have to make the right to care effective? Those problems, what do they imply? And those implications, what consequences do they have and how are they related to each other? We are not so much interested in going into discussions that place the right to care right in the center. We believe that right to care is already in the center of our discussions. We are already holding every day within the professional, political, academic, institutional spheres. Most of us are holding these discussions. That's why we're here today to start with. We want to think about the problems we have to make the right to care effective in different instances, as I have already said. And then the other difference in last year's analysis, this year we're going to continue having this focus on Latin America and the Caribbean. This doesn't mean that we are not connecting discussions of cases and policies throughout this year on what happens in other countries or regions of the world. In fact, we want to invite all participants to establish those connections and dialogues. Elisa has already started doing this, talking of what we did last year, but we are going to be presenting the first phase. We're going to be setting our region in the first interest. An important reason is that Latin America and the Caribbean have a pool of discussions and the stock of discussions on care activities as a right and as a job or work. And this is telling us so much in terms of categories, analysis, politicization, and this political aspect, in some cases, good practices. These are things we should be recovering to rethink about deficits and mistakes we have, but also in good practices where other countries can find inspiration for their own work. So what we already have today in Latin America and the Caribbean not only has to do with systematized knowledge, not only does it have to do with relevance on care activities in the public arena, but it also has to do with efforts at the standards level, at the institutional level, developed, that are being developed, about to be developed, or we hope they are developed in the near future. There are analyses of the region that have been discussing innovations and standards that are super important. At the state level, recommendations and activities done by international bodies recognizing implicitly or explicitly the right to care, the way this is done, and Laura will surely talk about this in greater detail. At any rate, we know also, because this is something we can discuss in last year's analytical community. We know that care is a human right, and this is a discussion that is now under the political debate as part of the necessary consensus of the gender agenda globally and at the regional level as well. We want to readdress the key points in that discussion. The Regional Conference on Women in Latin America and the Caribbean in Quito, Ecuador, 2007, and the recent one, November 22 in Buenos Aires, consensus agreements, commitments by governments and feminist and women's organizations have reasserted this acknowledgement, this recognition of care as a job, as work. And this is part of the analytical community and of our work. Now, in the Latin American process, having accomplished the recognition for standards and political and policies issues, aside from its consideration as a job, as work, this is extremely important. This is part of the way in which everything has been politicized, not only in the institutional fields, but also at the field of many other women feminist organizations. As we have said, within the group coordinated by FES, as Elisa just mentioned, we spoke mainly about feminist economics in terms of the care structure. That's why we have placed the region in the first level of our priorities. So there's a consideration, recognition that care activities are right in the center of our lives, and they're also right at the center of policies. Which are the key items? How is it that care is being politicized? Well, this is the responsibility we have in this analytical community. So we're emphasizing the guarantees and the right to care. What rights do we have? Who are the right holders? How do we guarantee that's right, this right? And what are we not doing to guarantee the right to care? And this implies thinking, of course, about common interpretative frameworks. This is what we're doing in this community. Which is the interpretation framework of the region, and how is this framework connected to other global territories that are also discussing those issues, and they are holding institutional discussions on the right to care. This also implies thinking of communication strategies. Which are those strategies that are now part of this interpretation framework and the right to care, and what do we have to do in the arena of public communication to move forward on making the right to care effective in terms of not only having communication strategies, but also discourses that are at stake at the public arena to recognize the right to care and give it the right value and to place it right in the middle of political affairs, not only political discussions. And thinking about this also related to political feminist agendas in the region and their very specific characteristics at the local, subnational, national levels, but also thinking about the movement, feminist movements that are participating in regional territories. And at any rate, what we care about in this analytical community is to have an in-depth analysis about the implications all this has for the exercise of the right to care, but also something which is key, and Laura will surely discuss it in a few minutes. This has to do with the link of the right to care with other rights of people. That is a framework of discussions we're already holding when we talk about the right to care, thinking about the interdependence of rights. We cannot talk about the right to care if we don't think or discuss other rights. So what we want to do in this analytical community is to consider deficits and the potentials we have in the region so that we can have effective right to care and find the links this right has with other rights. The right to care is related to other rights, and the right to care is interdependent with other rights. Thinking at the same time about all the co-responsibilities this implies, thinking about the social stakeholders and actors that have to be participating through their work, the work of institutions, standards, social links, to have this right to work and to make it effective. The right to care, I mean, in a very central fashion, but also looking into the analysis of other social actors that are fundamental when we discuss the right to care. Now, the analytical community we are now presenting set out to advance those discussions of all those issues, concentrating in Latin America and the Caribbean, as I have said. But we're going to do this through the analysis of specific cases. Choosing, selecting those cases was done deliberately, of course. It could have been a different method. We could have analyzed cases within the region, other cases within the region. However, this means that those cases are in the agenda. This means they are the ones that are opening our discussions, because in the analytical community, in each one of the sessions, we want those cases, we are going to be using case studies to start our discussions, to trigger our analysis. We'll be opening other topics for us to discuss with the experiences of other countries and subnational experiences as well. As you see in the conceptual note we shared with you, we're going to be working as of the sub-regional level. In the next session, we're going to be working with Southern Cone cases, Argentina and Chile mainly. The third session, we're going to be working with the Andean region through conversations on practices of Colombia, Peru, and Venezuela. And after that, we are going to the Caribbean sub-region to discuss the Dominican Republic, Cuba, and finally, we're going to have a discussion on Costa Rica, Mexico, and Mexico, especially the Central American situation. We are going to have a last session. As you see in the conceptual note, the idea is to present a report, an analytical report on everything we discussed in all those sessions. In fact, this analytical community has set out to generate three main products. We're going to be working on them in each one of the sessions. A main product is notes to summarize each one of the sessions. And then the second one is more extensive analytical report. That's what it is, for us to discuss not only and include not only the sub-region specific cases, and at the same time, the other cases that are going to be emerging as of our initial discussions in the sessions. This analytical report is set out to have a political report, a policy brief, helping us at the political level to continue installing and the keys proposed by this analytical community on how to make the right to care effective for us to place those issues in the institutional arena of many bodies and social institutions. So the discussions we're going to be holding, the objective of them is for us to nurture the report. This is going to be mainly a regional report, helping us to continue thinking not only of the right to care, but also the guarantees of right holders or the lack of guarantees we have in the region. So then, what we want in this month, and this is what we are proposing to you, is identify progress made, contradictions, obstacles, resistance, and the voids in the recognition and the effective exercise of the right to care in Latin America and the Caribbean as of the analysis of these national, subnational cases that I have mentioned and the other ones that you are going to be also including in our discussions. Finally, in the analytical community of last year, we identified issues that are now pending questions after the discussions we had 2022. For instance, those related to monetizing care. Is that a solution to intervene and to do away with an equal situation of care work, or what does it imply to recognize unpaid work, care work, but not recognizing those women as workers or care workers? How can we talk about the universal aspect of care activities and making that an institutional priority work? How can we generate a conversation, a policy around care activities with the intersectional characteristic, taking inequalities into account? How can we have standards on the right to care and care in general? How can we continue making progress, although we have already made progress in Latin America and the Caribbean in terms of the standards, especially? How can we generate guarantees for that work? So there are many pending questions coming from last year. Therefore, we wanted to continue analyzing them this year. That's why we're going to be mainly concentrating on the consideration of four main items. We are going to try to include those four items in the conversations in each one of the sessions we're going to be holding. Those items are the standards, implementation issues, third, strategic actions already taken in each one of those territories or that we still have to implement in those territories. And fourth, public policy agendas that are already being implemented or are being designed or formulated or we have to formulate. Those four fields will be guiding our presentations for each one of the national, subnational cases this year. They will be guiding the analytical report, the final report we're going to be making public. This will be guiding our conversation. Some come from last year and other issues are for this year. First of all, what does right to care mean? The implications of it, general implications, which is the concept behind it, but the specific implications. We know there are different implications. We have different concepts on the right to care through international national instruments. Secondly, the standards and national legislation, subnational laws that recognize the right to care in each one of the countries and territories, and which we would have to be transforming. This is a key question because we know that in some countries, the standards still have important deficits related to care activities in general, and they are reproducing the sexual division or labor division, and also the right value is not being granted to care activities. and the right to care, paid or unpaid care work is not getting those rights and not getting the right recognition. So we have to understand the changes we have to implement in terms of the standards in each one of those countries or territories. So we are proposing a discussion on public policies, the existing ones that are already contributing to the right of care, or the right to care, and which are not contributing. How can we make them operational? How can we make public policies operational? Do we require that? Which are the obstacles? Which is the resistance we are finding in terms of the implementation of those public policies, changes in standardization? How can we integrate this in public policies? And we are also proposing generating discussions on what has been the communication strategy for us to have recognition of care work in each one of our countries, and which is the result of those communication strategies to identify good practices, but also voids, vacuums, resistances that we have to identify to transcend. And we are also proposing to you discussing something about, what the region is going through right now in terms of implementing and the political aspect of the work of the different stakeholders in care activities, and finally, strategic actions that are necessary and possible to ensure guarantees on the right to care. Those are the pending questions we are proposing for this year. They are completely intervened. They can be reformulated and expanded by all of you in the sessions. The idea, I insist, is not just to make presentations that will be generating limited discussions. We want to present devices for us to rethink and repoliticize and to make the right to care more effective. This is the main activity of this analytical community. I think we now have a space for suggestions, recommendations, questions, and any comments you want to make, and anything you want to say in terms of the format, the framework for the sessions this year. Please. Yes, thank you so much. Here in the chat, we do have a few comments. And we are going to be enabling the drive for you to access all the information we have until now from the different sessions. And we are going to be uploading information of each one of the sessions as of today. We have recordings in Spanish and English, and everything, all the material is in both languages. Now, if you have any other questions, the last questions that Eileen shared, they're in the conceptual note of the analytical community this year, in case you want to take a look, analyze them, and we're open to your suggestions or questions or doubts you might have. Anyone, do you have any questions? Does anyone have any questions, please? Any comments on the work we did last year and what we are setting out to do this year? Please. Everything is clear, is it? Very well, thank you. Without further say, let me give the floor to Laura Pautassi, who is the coordinator also of this space. Laura Pautassi, she's an attorney, a feminist lawyer, and she is one of the persons that has promoted the definition of the right to care here in the Latin American region. Laura, you have about 30 minutes. Could you introduce this topic? And let me also tell you, this is a commercial. Well, one of the products we had last year that wasn't posed as a product originally, but Laura was able to write a document for us on the right to care. It was also translated into English, so the link, you have it in the conceptual note. You can download it, and I think that in the existing context that Laura will be sharing with us right now, this has become a key reference document for everything we are doing it throughout the region and what is coming. And Laura, I'm sure will be talking about this. This is an invitation by the GAC. This is an invitation for you. Yes, we see the document right now. Thank you. So the link is in the conceptual letter, the conceptual the right to care. Yes, and this is what we are doing, and this is what we want to do through the community. Please go ahead, Laura. Hello, good morning, everyone. What enormous joy I feel to be here with you today with our sisters. We've been discussing this since last year, colleagues, and I want to welcome those that are just beginning to participate with us. I want to thank all the institutions organizing the analytical community, especially the Mexico Ebert Foundation, our dear Elisa, for this process. With Eileen, thank you so much. And this is making us think of so many things. Personally, this is the second season of discussion for the right to care. And this for me, well, it makes me so happy because it talks about, and I do have a presentation, but I wanted to recover aspects that I have already been mentioned because they complement each other, as Elisa and Eileen have said. I wanted to talk about the relevance of this issue, of this topic. This is an extremely important item because it doesn't only refer to the relevance of different phenomena of this issue, historically speaking, and the issue, the way we look at it, but it has clearly become a situation that is not easy to solve. I'm talking about care activities in Latin America. We have different processes that are linked to very fast demographic transition, the crisis of care activities, crisis of the pandemic, COVID-19 pandemic, of course, and also academic relevance of different fields, not only feminist fields, but with a cross-cutting perspective. And this is a great reason for us to be holding the second season, the second edition of the analytical community. And as Eileen was saying, we should be maintaining throughout those meetings really attention, but we aspire to take one more step in that direction to recover, because I will be concentrating on a summary, introductory remarks on the steps we have taken to reach this point in terms of the recognition of the right to care. But also with this community, we're aspiring to create a reservoir, a stock of experiences, of lessons we have learned. This is the second step. This has to do with making this value effective. The exercise to care has to be made effective in the region. I think this is extremely relevant to start, therefore. See, to start with something that Eileen and Elisa have mentioned. What is the conceptual production and evolution of this concept? Well, this has to do with the theoretical production, empirical production in Latin America. With this, we're not vindicating anything. We're not placing ourselves only in Latin America as the continent where feminist mobilization and mobilist production has been clearly very robust. But we mainly want to talk about the characteristics, the indigenous, I mean, the native characteristics in this process, because we want to recognize not only the work that we did in last year, but we want to look at the transition of other regions. Asia and Europe are a case in point. They are going through different processes in terms of how they promoted this in their own regions. So I think it's very important for us to talk about production, but also about the process. And Eileen said it very clearly. Well, this is not just recognizing the human right to care. This is not the only thing. On the contrary, the basis for that recognition and for everything to be transformed, for us to transform this concept of care, this polysemy, and this is what mainly contributed to making this issue visible. And this is a patriarchal, androcentric vision, and care means everything. What feminist economists have introduced as a highly transformative concept in terms of life itself. And this had a political impact because it made it visible. So as of the basis of this recognition, and this is a summary of the conceptual trends in this polysemic type of analysis. This didn't just expand our work, it opened also a very important discussion. And here we have a recognition to expand the borders even more because we're recognizing care as a job, as work. And this is a very strong process of Ibero-American authors and great recognition to our feminist colleagues, Maria Angeles Duran, Cristina Carrasco, Cristina Tons, Teresa Tons rather, and all the work they did in Spain, but also in the Anglo-Saxon recognition of the work they did. But in the Latin American region, this work has even greater meaning because it goes right to the center of structural inequalities in our continent. This is the most unequal continent in the world. This is measured officially that, they measure the gap of income and wealth, personal income and wealth. This has to do with the unfair characteristics and the sexual division of work, of care work. And there's a confluence and intersection in terms of the configuration of the most unequal region of the world. So this has to do with the care as work. This is a central issue. And we were able to characterize the very native and the very territorial characteristics of those two concepts on direct care and indirect care activities. So there is a construction linked to the different processes taking place in terms of this intersubjective work for boys, girls, and teenagers. This was the first field in which caring for boys, girls, and adolescents. Well, this is part of the agenda in terms of the characterization of this intersubjective link, but especially the activities we are implementing so that today in the region, we clearly have determined to look at direct care work for the elderly and especially for people with disabilities. This is the first conceptual basis that could also determine indirect care activities. There, in this conceptualization, care societies, caring for the environment, all those preconditions that generate care, the region has very particular characteristics and elements. Now, progress, this interdisciplinary outlook that is part of our historic feminist work and agenda, determining the economic value produced by care activities or care work. It's not only that our colleagues, our feminist colleagues, the feminist economists, not only their work has allowed us to see the contribution of this non-monetary community that has an impact on the monetary community. However, we have started processes to quantify estimates as of methodologies linked to satellite accounts and other estimates. This was clearly those processes. They were highly motivated by partnerships between civil society organizations, feminist academics, and the transformation in statistics institutes. So this process has to do with institutional capacity contributing to this agenda. I think statistical production and care activities meant a very important agenda change. This has to do with GDP figures, and this has made it easier for agencies to participate for things that are regional issues and for those issues to be included in the public agenda. This is very important. It has to do with the construction or the strategies that are being used in the feminist movement, participating with other sectors, as for instance, intellectual sectors, academic sectors, and state activities. That's how this transformation took place. So this is the transformation of the original concept of reproductive work. We were also moving forward on care work and on economic issues, the economy of care, and this has to do with public policies, of course. And then we started denominating things based, and this is something I place right in the center of the recognition of care as a human right, and I will go into that in a minute in recognizing that care work is a human right of the individual, of the person to care and to be cared for, and to also have self-care, especially in self-care. This is a field in this region that allowed us to consider the fact that initially in that identification of care work, for it to be a nucleus that hasn't been quite explored. So this conceptualization of the right to work was mainly produced with a lot of strength. It's been taking place for 15 years, as Eileen mentioned. The milestone was the Regional Conference of Women in Latin America and the Caribbean as of the Quito Conference of 2007. And we started developing, as of that recognition, saying that care is a human right. We started looking into national care systems. Uruguay has a leadership position. We used that example in our meetings last year as the first experience, not only because of its pioneer character, because the basis of that care policy that has to do with the redefinition of care activities. This is as of recognizing that work. And in the Uruguayan case, well, they said care is a human right. Therefore, it implies obligations of the part of the state. And today, we're also going through this, and this is also very important because we're recognizing the value of consensus. But in consensus, we have to remember those are processes that take place regionally, where the governments also give their support and conformity. They are taking upon themselves those agendas linked to global gender agendas. Those government consensus of civil society, specialized bodies, are those that have allowed us so that the last commitment, which is the Buenos Aires commitment, we've gone not only from care systems like the first experiences that are transformative experiences in public policies, we went from there to promoting a society covered by care. Well, this is a very important transition because this is the transformative value of the concept of gender focus and also of human rights focus. This transformational potential is central for the proposal that was clearly embraced by civil society and governments of the regions to transform the logic of what care as a social activity means, as work, for instance, care as human right, plays right in the center, as Eileen said, of political decisions, of organization, social organizational structures and methods where the stakeholders, the state participating, the markets also as participants, or the private sectors, and families also participating in care activities. Families, not only historic family participation, the women that are only the ones in charge of care, but thinking of the family in terms of a space, urgently needing to redistribute those care responsibilities. And the fourth central actor is social community organizations. So then there's a permanent organization, the devolution, this polysemic structure is disappearing little by little. There's a stock, a repository at the bibliographic level, empirical stock of knowledge we have to take into account in the region. So in this scenario, when we start thinking about strategies for one of the items of interest of this care community, not only a conceptual summary or recap, but for us to think how we can establish better pathways, better forms for this social issue to be part of the public agenda. Well, care was considered as work, yes, but how was it really considered? we had standards, we had legislation. One of the historic practices of feminism in the region was to think about transformative legislation, guaranteeing voluntary interruption of pregnancy, standards promoting national sexual reproductive health programs, and legislation for against gender violence, and also affirmative action legislation, so also parity included in all this. So it's no surprise in terms of the standards, because the civil right or the family right in terms of the evolution or the relationship of private relations always recognized care activities. It just simply didn't have the right consideration in terms of the production at the interdisciplinary level that has already been mentioned here. How do the civil right regulate care activities? It regulates them very much linked to interpersonal relations. So then there's a clear link in terms of obligations of, what parents have over their children, what we have over our parents as children that we are. So this is a situation in terms of autonomy, economic autonomy, physical autonomy, political autonomy, and we clearly have an obligation of assuming this work and responsibilities of everyone around us and ourselves. Now, those relations are part of the link of interpersonal relations in the family sphere with profound gender biases in terms of the codification processes of civil commercial relations in the region, with an initial consideration of autonomy of women, which is not full consideration, but mainly linked to their relationship with their parents or spouses. And in fact, there are standards that haven't that are still there in the region, establishing, making it mandatory and compulsory for women to ask for authorization from their parents and their spouses, their husbands, to get a paid job. There's another reconsideration with a profound standardization biases, and this makes it an obligation of persons in terms of what they do with their own lives. Now, the other sphere of establishment and recognition of standards of care, it has to do with labor rights. Labor rights are a very important field of recognition, and this is consolidated in the 20th century to establish standards in the link of relations at the interpersonal level, and this link with civil rights, part of the autonomy of the individual will, to take it to building a structure with initial understanding with no symmetry. This has to do with work and capital, with labor and capital. This is not a symmetric relationship. This is an asymmetric relationship, because in the labor world, workers suffer their labor force, skilled workers or unskilled workers, but we are creating an extraordinary fiction in terms of labor, right? Uniting these two parts for this bargaining or contractual agreement. This is completely marginal related to care activities, because here we're talking about special titles of labor codes for the relations linked to reconciliation policies between the family and work activities. We've always had a lot of problems with this reconciliation concept. We know that something that is not to be reconciled, paid work and unpaid care activities, but this is part of the coding process. This is part of this codification process. Now, the point is that with a very strong gender bias, because the budget to incorporate these policies of family and labor activities, this has to do with women workers when they have a paid job and taking care of their children. A lot of the standards establish They say it is mandatory for the employer. And here we see the relationship of the state as a regulator and also imposing responsibilities on third parties, the private sector. Well, this means the private sector has to generate policies, for instance, of spaces to care for children vis-a-vis the number of women workers they have in the companies, not the men that are working in their companies, but only the women that are working in their companies. And therefore, the budget is centrally saying what we have, we haven't had the right modifications. Those women that have a hard time to find a paid job, and it's women who have this problem. And what about labor rights and the rights to social security? This is not for everyone. This is only for those who are going to have a specific condition, the condition as a worker, a paid formal worker. So there's a contract, and the effect of the contract is formalized, and therein it includes conditions in terms of the time the person is going to be working. It has to do also with many other of the parental relations, and this has to do with the state and the way it says the care activities. This also has to do with licenses and only associated to this parental absent permits, and this has to do with things that we have already mentioned in terms of gender. What about men leaving their work between 2 and 5 days whenever there's a new child in the family? And this has to do with this licenses for formal workers. But what about the males that can have this parental leave of absence? And in Cuba, this is already happening in other places, but this regulation of time has mainly to do with formal workers or employees. And then also the amounts in which the states are transferring this possibility only for their paid workers. And this has to do with taking care of men, taking care of their children, or being there when a newborn child is in the family. And does it make it mandatory for those employees to participate? But regulations, when they exist, is for first infancy. But what happens? There are 2 days in Argentina and 2 days of leave of absence for male workers, and also days for the death of parents or parents-in-law. The other licenses are not there. They are not being recognized for male workers. We have other standards. This is taking place since the 90s. And the first decade of the 21st century, income transfers through the component of social components in most countries. We have revenue or income transfers for boys, girls, and adolescents. They are the ones, the holders of those transfers through different programs with different names in different countries. Over 21 countries of the region have income transfer programs. They're growing even. And however, who is the children that are recognized, but the women, the mothers, are the ones that are supervising, but this is not being highly recognized. And there's a punitive burden in terms of compliance of both elements. This has to do with the interdependence of rights, that is to guarantee children the right to education, access, and the right to health and education. But in the case of the mothers, the guarantee of those rights is a punitive element, because if there's non-compliance, then the transfer is suspended. And this is not the same situation for formal paid workers in formal contexts. So here we have a consideration, but we also have a reduction in terms of the recognition of women's autonomy, because generally being able to participate in this income transfer programs, this is incompatible with a paid job. So this is not, this is only for women who are don't have a paid job, but they have all the burden of care activities, and it also has this punitive element, and they cannot participate in paid jobs, especially women under vulnerable conditions. We have a very broad set of things, but also disassociation in terms of social protection, in terms of care activities. There is no recognition on transportation systems, subsidies, for instance, to accompany, the displacement from the household to schools for the mothers who are directly assigned by assistential bureaucracy as responsible for caring for their children. In general, there's no confluence in terms of responsibilities of men. And well, we are seeing then, let me now tell you about these items I want to share with you in terms of the right holders. Yes, boys and girls and adolescents were recognized as right holders from the beginning. They were objects of care and then they were right holders. And this is the major marvelous transformation of the human rights system is with the children's Human Rights Charter. This is one of the main changes in the agenda. We already had senior citizens, the elderly, people with disabilities, and people with certain diseases, mental health problems. And they said of people who are not invisible in terms of the care they need, paid care workers, women care workers. This has to do with the standards vis-a-vis paid domestic services, and this is one of the highest places of discrimination. Today, in many countries, there are verbal labor contracts. Women are completely unprotected and they're completely invisible. In 2011, the ILO signed agreement 189, but then the community in this type of central work in terms of care, the community work was central for the most vulnerable sectors. However, they're invisible, just as the people of diverse sexual identities. This has an intersectional impact, and for instance, the recognition of standards of egalitarian marriages, and also in terms of gender equity, this recognition and this extraordinary progress in standards is not reflected in the standards recognition of care responsibilities. This requires an important adjustment that will have to be made. Unpaid work for healthcare services, also in terms of the processes that are increasingly frequent in the health sector. Reduction of treatment, of hospital days, and for unpaid care work in homes, always done by women. And clearly, this is something which is also very invisible, the work of boys, girls, and adolescents who do care work, but this is highly invisible work done by those younger generations. So in 2007, we analyzed the situation. We went from labor law, civil issues, but what happened at the human rights level? Something important was for us to do this analysis, considering the methodology with a human rights approach. This is a methodology of the 21st century, hand in hand with a proposal of the human rights system, taking this concept, but the central concept, and changing paradigms of contemporary feminism, because the way we look at it has to do with a cross-cutting methodology. So in this application of this methodology with a human rights approach, we identified this is the Universal Declaration on Human Rights, and in case of the Inter-American system, of the Universal Declaration of Men, and from the first to the last statement or declaration in the Inter-American system, this was the Inter-American Convention on Protection of Human Rights of the Elderly. Care is recognized in some cases. This is explicit recognition. And the concept is much reduced in terms of the definition of care. However, it is recognized, although this is not completely recognized. If a state recognizes and signs this agreement, it's a binding document and responsibility. And this has to be, it has to do with the right to care for and to also care for others and to care for yourself. And this has to do with the new changes. This implies concrete standards for the different states. The principle of universality is universal, as the name says. This has to do with state response in terms of this obligation and international agreements, and this should be reflected in their institutional response. So here we see how the region, it takes this recognition in human rights within the sphere of consensus agreements through the Regional Conference of Women in Latin America and the Caribbean. This is our sphere of consensus. For 3 years, it will, since 1974 in the Havana Conference to the Buenos Aires Conference in 2022, we're generating local policies of consensus of gender throughout the region. In 2007 in the Quito Conference, where we recognize care as a human right. As of that point, from there on, this was also an agenda consensus with different participation of women's institutes and ministries. So from there on, we have commitments. As of Montevideo, we have the final conference agreements that are being negotiated through those types of international conferences, and there's agreement that the countries signed, and if they didn't agree, they would pose their disagreement, but there has been no dissidence until now in terms of recognition of care as a human right. So the region has committed itself to seeing care as a human right. And in those conventions, I have mentioned the convention, which is a very important case in the region. It is the specific convention of protection of human rights of the elderly. That's where we explicitly recognize the right to care. And there we also talk about this regional care systems. We also have recognition of unpaid care work and declarations of plurinational states. The Constitution of Mexico City is the first one that does this change, recognizing care as a human right. This is also done at the federal level in Mexico. And the Chilean situation, unfortunately, they had started this process through a citizens motion recognizing care as a human right. In the first constitutional instance, it wasn't passed, and it wasn't passed. It included care as a human right. We have jurisprudential activities. So the care as a human right is part of the Constitution, but it doesn't imply changes because the states have already recognized it in terms of principles that are ruling most of our countries. So we're moving forward on a proposal made by the Inter-American Women's Convention with the model legislation for care. And there's an important innovation this year. Undoubtedly, this is going to be part of our debate. This is a request made by Argentina for the Inter-American Court of Human Rights, asking them to interpret care as a human right linked to the American Convention of Human Rights. This is a process that it's an open process. We want to invite you if you want to participate in this so that we can have the right arguments for the court. But this moment will surely be a new foundational moment in the region, and this has to do with care as a human right. And to conclude, to open the debate for your questions and comments, what we have, as mentioned by Elisa and Eileen, is a very important strength, regionally speaking, because when we recognize care as a human right in the different international accords, we have included a methodology, and we are taking that to the different states, reminding them they have committed themselves to generate consensus agreements, and the individual is right at the center of this, regardless of the individual's condition as a paid or unpaid worker, as a formal or informal worker, even if this is the wife of a paid, formally paid worker, taking into consideration vulnerability in terms of the method for income transfers. This is a universal right. And this is has to do with the obligations and the recognition of that right. And this right also implies empowerment, important empowerment. In the case of Latin America, we always follow suggestions of great Mexican feminist anthropologists, emancipation. This is a collective thing. In terms of collective emancipation, cultural changes are very important. To see that, to show that the region has built this look which is centrally based, which means care is a work and it's also a human right. This is an important agenda change, and this it makes things more visible. It makes self-care more visible with a feminist agenda. This is key in all our work. So generations throughout the history of women who have never cared for themselves, but they've spent all their lives caring for others. So then the conceptualization, but also their own awareness of their self-care is their own right to care for themselves, to generate this transformative agenda of their own agendas. And this is an extremely extraordinary change. And here we see the central interdependence, because mandates of human rights of the states are not only obligated to guarantee civil rights, but also civil rights, political rights, economic, social, cultural rights, environmental rights as well, under equal conditions in an interdependent manner, allocating maximum resources so that progressively, with the provision of non-regressivity, we can meet we can fully meet the needs of people. And this has to do with the transformative policies. We have to strengthen them. 15 countries of the region are now designing care systems at the national level, local levels, or regional ones. This is the transforming agenda, which is extremely important in those countries, always reminding us that this has to be a transformative feminist agenda with a gender focus. I think this is the big mandate we now have after having built the approximation in terms of care. No doubt, the care is a human right. There's no doubt about it. That's why we've been able to change agendas. Now, to conclude and open the debate, I think we have the questions here. What do we do to implement rights? Feminist practice has told us that after Beijing, after the many conferences we've gone to, with all the modification of legislation, the different conventions, and generating different standards, and many times those laws and standards, we don't have the right results for them. This is the big dilemma we are going through. And we know that the concept of citizenship establishes this, but it doesn't guarantee any formal, it doesn't guarantee material equality, it only guarantees formal equality. So we have to remember this as a human right, but we have to move forward on this to make it effective. And this should be the diamond of care. We should be including the actor stakeholders within the diamond. And we should start with this process of transformation to strengthen standards. But this requires so many other elements, like public policies reflecting obligations of the state and the response in the face of those obligations, where the state operates on this diamond of care, but also in terms of obligations of the private sector, social community organizations, community work, for instance, and how this operates in interpersonal relations. How do we transform interpersonal relations when males, are they going to be involved in care activities? In the region surveys say that this is not happening. Things are not changing. Men are not participating. It's a static relationship. In the pandemic that made care activities more visible, this has generated a regressive process in terms of the labor division and sexual division in the household. That's why we need cultural changes. They're extremely necessary. But the last thing I wanted to say is, how can we turn something like care activities, which is work, which is a human right, to guarantee sustainability of life? How do we make it not become intangible like any other goods? And the environment, for instance, climate change, are also major topics in the agenda. But how can we be able to build the relevance and also compliance of obligations? I stop here. I see some hands raised for the beginning of our debate. Thank you. Yes, we're having connection problems, but let's continue with someone else. I'm delighted to be here. Thank you so much for allowing me to participate in this community. I think it is extremely important, very interesting as well. Everything you have said is very important. Elisa, Eileen, Laura as well. I do have a question, a reflection. If you could comment on it, please. We've been working on the human right to care. This is extremely important. Latin America has done a lot of work in the conceptualization, not so much in materializing this right. However, all rights imply obligations, as Laura said. We have a horizon society of care. Well, how is it that we are going to be taking the next steps to reach that great horizon, a society where we all participate? This has to do with reproduction of human society. And this has to do with reproduction of the natural environment as well. This is one of the guarantees for human survival. Now, those care activities, I'm not an attorney. That would be the guarantee for that right to care to be exercised. Historically, our society has set the obligation through sexual labor division. It has set this responsibility on women. So what I think is that if we don't work on obligations and guarantees on the right to care, normally they will go back to women. This is what is happening at the community level. We in Latin America, the women have a long history of community organization. Impoverished sectors of the community That's women. We saw it throughout the pandemic, especially. I remember, for instance, we did work in Latin America, for instance, in Chile, over 3,500 soup kitchens or popular kitchens throughout the pandemic. And of course, the concrete everyday work was mainly done by women who were doing the cooking and the rest of the work as well. So the obligation or the guarantee of the right to care has to be egalitarian, or as egalitarian as possible. If not, we're going to be reproducing this inequality in labor division that we already have in our Latin American societies. When we generate rights, we end up having those rights just for one part of the population. My question has to do with obligation and guarantees of those rights with an egalitarian angle of real equality. Thank you. Extraordinary presentations. Thank you. Yes, Rene? What a pleasure to be part of this analytical community. Thank you for allowing me to be here. This has been quite an interesting analysis of the right to care. This is telling us exactly where we're at and what it is that we can continue doing in our work. I have a concern. I think even though this was a debate of the previous analytical community last year, I think we should be discussing what do we understand by care. We talk about care as the essential element to sustain life. I think we continue not clearly understanding everything that implies. For instance, thinking about healthcare services, it seems that it's a matter of having available services and coverage for the entire population when people get sick, etc., etc. So the center of this is services, hospital facilities, medications, and other services. But I think the in care activities, affection plays a relevant role that perhaps we're not taking into account when we talk about the right to care or the leaves of absence for fathers. So how can they have more days in their leaves of absence, but without recognizing masculinity for us to, as males, to be incorporated in care activities? Basically, there's a disassociation of emotions. How do we include the affectionate link in care activities, real support? How can we truly be inserted in family activities, care activities? When we talk about the school situation, so how can we include the families? It's not only what children learn in schools, but affectionate relations. How are they taught in schools? I think the discussion between care activities or of care activities is not on what is done, but how is it done? And I think this has to do with a very revolutionary way of looking at the care concept, the way you are doing it. It has to do with sustainability of life itself. I think this is a great moment and the sessions we are having and that we are going to continue having will allow us to discuss this, taking into account the definition of care activities not only something that is done, but something that is done in a very specific manner, revaluing the emotional part, the affectionate part of all this. This could shed light on what it is that we should be demanding from the different actors and stakeholders that should be engaged in all this. Thank you. Thank you, Rene. Monica? Hello. Thank you so much. Congratulations for this forum. Thank you so much for such clear presentations. I wanted to comment on 3 items. And Laura, I wanted to request your opinion on this, of some of the things we have already discussed in other meetings with Elisa. We've already commented this. The first thing, on one hand, we have various instruments that make explicit recognition of care, the right to care for others and the right to be cared for, and self-care, and constitutional modification and new legislation with the vision to make this operational, going from the general framework into more operational aspects. But more than the substance and the essence is the mechanism of governance, the system, the mechanism that will allow us to do this, establishing the obligations of institutions and governments. But for what? What is the context of all this? This is part of the agenda we have. We have other proposals on reforms and modifications. Unfortunately, they're incomplete. Not many recognize self-care. I think this is a fundamental concept, because this is exactly what sets the population in this niche of the whirlwind we're all in, this whirlwind. So that's why I find your comments so important. Laura, how should we advance this narrative through proposals that are incomplete? On one hand, we should celebrate them because this means progress is being made, but they are cornering us in some excluding concepts. The second thing is to say that this concept of interdependence from the human rights approach, this is understood as the interdependence of rights, the right to care, the right to health, the right to education, the right to work, etc. But I think from this perspective we're discussing today, and I'm saying this because in Mexico we had a conversation on this. I, as a part of an intervention at the Human Rights Prosecutor's Office with Alma Colin from Gender Equity, we spoke about counterposition of rights. It's explicit in the discussion, however, it's not specifically named. This has to do with the relational aspect of care. You are a lawyer. Maybe you could explain this better. I don't think this is included in the concept of interdependence. It's not only my right to care and to be cared for, the rights I can exercise, but my right, the right of my children, the right of my parents who need me at a certain moment for me to care for them. So this concept of contraposition, what do you think of this? I don't want to take any more of your time. Thank you. Thank you, Monica. Why don't you write your question in the chat as well, so that we can continue answering that. Laura, can you take some 10 minutes, and Eileen, and then we have to close. Thank you so much for your questions. They're not really questions, they're valuable contributions. As Elisa said, they're going to be of great use throughout this process. Well, I agree with everything you've said. What Alba said in terms of community workers and the fact that they're still invisible. But we are using friendlier terms, but still invisible. We're not giving them full answers or response. From the experiences we know until now of paid care work in this field, for the elderly especially, generally all that recognition we now have of care workers that go directly to the people's homes. We don't yet understand it. I mean, this is paid work, but wherever it falls. In some countries, Argentina, they have registries with certain formality, but it's not really giving formality to anything. It's just the person who says, I can do this work and I will do it. But it gives formality to nothing. So there's a void for community work, unpaid community work, and community paid work. How can we formalize those activities? This is something that should be recognized, especially because there's confusion. And then we go back to the polysemic term, and we go back to making this visible. What about home workers, people who go directly to the families, and they're just not caring for the elderly, but they also have to do housekeeping in that house? This is something that hasn't been identified. A big example is the counterfactual example. Paid housekeeping work. We don't see that. We have gender bias, colonial bias. Formalizing and recognizing that work is something which is not guaranteed. What about the protection in terms of making care work effective? This is something we should look at so that we are not repeating the same situation when we talk about care as a human right. I fully agree with what Alba said, and also in terms of the principle of equality. Let me give you another counterfactual indicator. The gender situation explains many things, but we still have to remember how we can implement this. The entire region has gender violence legislation. The region has important policies, but are we really moving forward on this? However, the femicide rate is not only increasing, but it's also stagnant. This talks about structural inequality. So that's why those policies are not doing those transformations that are so necessary. This has to do with education. In care activities, we have the same situation. This has to do with life sustainability, but it is also associated to standards of equality. The problem is that, and we might have all the theoretical scaffolding, the Celia Moros theory on the logic of equal or identical. This is a hierarchy process. Historically, that's the way it has been. It doesn't mean that this work is going to be hierarchical. This is a central issue. This is the watershed element in our discussions. And now Going back to what Renee was saying in this direction, very respectfully, this has to do with the construction of subjectivity of masculinities or new masculinities. This is a very valuable field in the construction of those that are holding this type of discussion. But I don't think that construction of subjectivity is not necessarily something we should be doing now. But men are not really taking care upon themselves. They're infallible. Small progress is being made. The counterfactual indicator is this caring for children, playful activities. But the pandemic showed that when school was transferred to the household, it was re-feminized. And well, especially in some disciplines, women are not participating in everything, but yes, in household activities, especially throughout the pandemic. So we see no fundamental progress being made here. And the sisters, look at the daughters, the sisters in the household. Sometimes men participate in going with a relative to the doctor's office, for instance, for a doctor's appointment. But I think subjectivity is extremely important because it is doing this type of work. That's why it is so special, so difficult to characterize. But the orders of gender were the ones assigned. So paid and unpaid work has to do with gender orders. That's what we have to dismantle, this historic conviction. This is patriarchal. And I agree, it's important to understand what you have mentioned, Renee, but the subjectivity will take place if we really take this care activity into ourselves. And so men may be saying that internal logics of power distribution in households doesn't allow them to move forward in their own subjectivity. That could be a possibility. But what about care activities, not only for women? How can they transform this male activity? Dear Monica, I'm always learning of all the debates we have in the different spaces. I fully agree with you on the importance of self-care. This is the basis for labor division, of the service of idle time. For men, it's more than for women. So if we don't see self-care as a human right, we know this has to do with our health. This has to do with the interdependence of human rights, of all rights. If we don't do it that way, we're not going to be transforming anything because the patriarchal matrix of women mean that the women will be giving up on their own time and they will be caring for their children, for others in their family without caring for themselves. We not only do not have the social demand of care activities, this is quite a controversial issue. Many times women do not see the need of not participating in care activities. They see it as their imaginary obligation. And this is the type of imaginary that tells us that women, a society at large, but women believe that children are better cared for by the women, by the mother. So this is not only a problem of infrastructure, but also of demand on the part of the women. And not necessarily are they seeing that as a demand. Not necessarily are they seeing it as a resignation, but they are prioritizing. They're caring for the children. This is a fundamental task without the full autonomy. The problem is which are the margins within context and structures of social gender relations that we have in the region. What can we do? In terms of the interdependence, and this has to do with the way we look at things. And this has to do with rights. I know this is a debate, the contraposition of rights. This is taking place in Latin American countries. I will discuss it in other debates. I'm very much interested in this. But I do think this contraposition, it has to do with interdependence, and that's even more important. It's because, as you have said, the states are not complying with everything they said. They are repealing standards, and they are not complying with everything they have signed. And this has to do with the judicial situation of the region and the protection at the inter-American level. Permanently, we have this situation, declaration of unconstitutional standards, and also conservative attacks. I didn't want to mention that at the beginning because I'm very happy with this new season of this analysis. But at any rate, we have a conservative, neoconservative attack. And yes, care is right at the center of this, and not it is not being recognized as a human right. This is a concern on on measures of refamiliation. So then, the contraposition of rights, I think this has to do with the central nucleus of the action platform of Vienna Convention, telling the states what the mandate is, not only civil political rights, but also economic, social, and cultural rights. This implies, well, the focus on human rights. This is something we've recovered. And this means having this hierarchy of rights we shouldn't be allowing for, because then we have the right to life with its own interpretation, far away from feminist interpretation. So I think interdependence places those obligations within their own context of resources, territorial concepts, and also powers of the state, because this is a very important item. We don't have time for that, but then we could work on this. That's what the Inter-American Court is very important, an interpretation of the right to care. This is very important. Those are my reflections. Those are just my reflections. I don't think I answered any of your questions. Thank you. Eileen, 1 minute, please. Just wanted to say something on the first intervention at the end of the analytical community. I hope we're moving forward in this important analysis. As I said, alternatives for the right to care. When we think how those guarantees are offered, and this has to do with policies and services that are enabled according to the right to care, more than just standards. How do we intervene in standards? And this is so unequal in so many countries. And the analysis we have tell us that at the regional level, the most important deficit in terms of data and numbers is related to policies and services. We don't have much information on coverage of services related to care or policies related to care. The analysis we did has to do with different situations in 11 countries. And this has to do with the situation of care work and the right to care. This is something that doesn't have enough information. I mean, systematic information, specific information. We don't have that on services, coverage, and quality. So yes, we do have information. I invite you to consult the publications we have with different general trends. We know that within care services with certain priority, we have those on caring for children related to services for the elderly. However, we also know that caring for children, this is something that none of the countries have a coverage of over 30% of the potential demand. So we do have information and trends, but there's a profound to look at those issues, to find out, at least for the cases we're going to be discussing, which is the situation and guarantees for right holders, to look at contradictions. I hope that at the end of these discussions, we have a better answer on guarantees, which is the key item of our conversation. Thank you. Thank you, Eileen. Well, thank you. To conclude, let me just tell you that each session, after each session, we have a summary note with the content of the session, questions, concerns as well. Everything you write in the chat and the recording will be helping us. Our next session will be July 25th. As we've already told you, we start with the cases of Argentina and Chile with major questions and more specific questions you're suggesting here. We are going to be including them. And we will also send you the link for the drive where you're going to be able to revisit our sessions and all the material. And let me also tell you that upon the invitation of the Argentine ministry, after the request of the Inter-American Court, within the framework of our sisters in the GAC, the purpose of discussing the right to care. They're inviting us, and later you are going to, Tuesday, July 11th. We didn't want to devote one of our sessions. This is an intermediate Tuesday, July 11th, Tuesday. We're going to have a Zoom session with our Argentine colleagues that will be presenting this request, the content, and especially ideas on how it is that we in the Latin American civil society can participate. You have our emails. Thank you so much. Have a wonderful week and see you 2 weeks from now. And then the second session, July 25th. Thank you.